Hi.
Hi.
My name is Rebecca. I'm going to be the nurse practitioner looking at Penelope today. Congratulations.
Oh, thank you so much.
How old is she?
She's a week old.
She's a week old. Incredible. So in order to do like the physical examination, we first start off with some questions. We'll walk through that and then we'll talk about any concerns that you potentially have and then do the exam, okay?
Okay.
Perfect. So in regards to you and the pregnancy, did you receive prenatal care?
I did, yeah.
Perfect. And then when you did give birth to her, was it via C-section or vaginally?
It was a vaginal birth.
Okay. And was this your first birth?
Yes.
Okay. Was this also your first pregnancy?
Yes.
Okay. And no complications afterwards either?
No, I was lucky.
Perfect. Do you remember what her APGARs were?
Yes, her first APGAR was an 8 and her second was a 10.
Perfect. And then, do you know how much she weighed at birth?
Yes, 7 pounds, 8 ounces.
Okay. And then we just kind of going to talk about her feeding habits, her stooling habits. It's super important during the first couple months of life just to see how she's getting nutritional needs met. So today she's officially 7 days old. Are you breastfeeding her, bottle feeding her?
I'm breastfeeding her.
Breastfeeding her? Okay. How often is she eating?
I would say 8 times a day.
So about every 2 to 3 hours?
Yes.
Perfect. That's great. That's normal for a newborn. I would also say if she is sleeping that you'll need to wake her up every 2 to 3 hours to feed. And then since you are breastfeeding, if you could try to aim to do 10 to 15 minutes per breast just to make sure that she's getting enough nutrients via the breastfeeding. Stool wise or wet diaper wise, how many wet diapers you've been seeing per day?
I would say anywhere between 6 and 8.
Okay, perfect. At this stage, she should be having 6 to 8 wet diapers a day. If you do notice any decrease in urine, just reach out to the doctor's office and we'll see you. Okay.
Okay.
And just some other information. Is there any like smoke exposure like tobacco use at home?
No.
And then are you getting enough sleep?
I'm pretty tired, but I would say I get anywhere between 2 to 3 hours at a time throughout the night.
Hopefully you have some help at home.
Yes,
Perfect.
My husband's very helpful.
Awesome. And then just to make sure, like for our records, did she receive Hep B at the hospital?
Yes.
Okay. She won't receive any vaccines today, but we will go over some vaccines that she will receive in the future.
Okay.
Perfect. And then do you have any concerns that you want to talk about right now?
I don't think so. I just want to make sure she's nice and healthy.
Okay, perfect. Okay, so we'll start the physical exam.
Okay.
Okay, so here I have baby Penelope. Her vital signs today, her temperature is 36.8, her blood pressure is 80/40, her heart rate's 140, her respirations are 42, and her pulse ox is 98%, so all of her vital signs are within normal limits. Her weight today is 7 pounds 6 ounces, which is down 2 ounces since her birth weight. However, she is breastfeeding, so we'll give her 1 additional week in order to regain her birth weight. Her height is 49 centimeters and her head circumference is 35 centimeters. All right, so we're gonna start our physical exam on Penelope. I don't have my ophthalmoscope or an otoscope, but I have a phone, so we'll check her pupils to make sure they're equal and reactive to light. Perfect. We'll check one more time. All right. We can look up her nose to make sure the airways are patent, there's no erythema. And then we'll look into her ears, making sure the tympanic membranes are pearly white, no erythema, no effusion. All right. Tympanic membranes are pearly white, no erythema, no effusion present. And then we'll try to look into her mouth as best as we can. And then with our gloved hand, we can put our pinky into her mouth to make sure that she has the suck reflex to see how strong she's sucking. This can be a good indicator on how well she's feeding. We'll also check her hard and soft palate to make sure they are intact and there's no cleft. All right, and then I'm going to lay her down. We're gonna move on and listen to her heart and her lungs. We'll start off by listening to her lungs in all 6 quadrants. All right, now I'll listen to her heart in all 4 quadrants of both the bell and the diaphragm. Right, now we'll sit her up and listen to her lungs posteriorly. Right, so her lungs are clear bilaterally, no rales, no wheezes. Her heart has a normal S1, S2, no murmurs, no gallops. We're gonna move on and now listen to her abdomen in all 4 quadrants. All right, now we'll do light palpation of her abdomen. Ensuring there are no masses, making sure that's not rigid, we want it to be soft, round, non-tender. And then we'll do deeper palpation. Right. Then we can check her Gauss reflex by putting our hands in the palms of her hands, or putting our thumbs in the palms of her hands, and her fingers will curl over our thumbs. We can check her brachial pulses. Can check her femoral pulses. And then with her diaper off, we can check her genitalia, make sure there's no abnormalities. We can check for inguinal hernias. And then we can check her plantar grasp or plantar reflex by putting our thumbs in the sole of her foot, and then her toes will curl over our thumbs. We'll check her Babinski by moving our finger up her foot, and then her toe will dorsiflex and her greater toe will dorsiflex and the rest of her toes will fan outwards. And then we can check her hip joints, making sure that she does not have hip dysplasia by first starting with the Barlow technique, where we bring her legs into a 45-degree angle. We're going to put pressure downwards. If we hear a click or a movement down or feel a movement downwards, this will indicate a positive Barlow. We follow this by doing the Ortolani test, which is going to be abduction of the hip outwards. So we're going to pull the leg outwards If we hear a pop and feel it shift back into place, that's a positive ortolani, which could indicate potential hip dysplasia. If you have a positive Barlow and ortolani, you're going to want to do a referral for orthopedics. And then we will also check the Moro reflex by holding behind the head, and we will slowly drop the baby downwards a little bit. When we do this, both the arms should flex outwards, which would be a positive Moro reflex. And that is the assessment of our baby Penelope. Hi Gabby, so I just wanted to go over the results of the newborn assessment. Everything looks great for Penelope. She's in perfect health right now. Just guidance going forwards, I would say just continue to feed every 2 to 3 hours. If she doesn't wake up in the middle of the night, it's really important that she does get this nutrition during these first couple months so that she can grow and just meet the nutritional needs for her body. So if you can, wake her up every 2 to 3 hours at home if she's not on her own. Ensure if you are breastfeeding that she is getting 10 to 15 minutes for each breast during each feed. And then also continue checking for wet diapers. This is a sign we can tell to how much milk they're actually getting. We want to make sure that she's producing between 6 to 8, but potentially 6 to 10 wet diapers a day. Okay. And also ensuring that she's stooling at least once or twice a day as well. Okay. Because she is breastfeeding, it should be like a softer yellow, seedy or pasty stool. If you see any changes in that, also let us know. But she doesn't need any vaccines today, like we talked about. She received the Hep B at birth and also the vitamin K. The next vaccines that she'll receive would be at her 2-month checkup. The vaccines that she would receive then would be the Hep B, Rota, DTaP, Hib, pneumococcal, and polio. Oh, wow. So those will be at her 2-month, and then we'll continue to keep her on the vaccine track, and she'll have the next set of vaccines at her 4-month and then 6-month appointments as well. Just some other advice: if she do notice that she has a fever, just call us and try to keep her away from anyone that you know is sick at the time, just because she is so young and like brand new that she's doesn't have the immunity that we have, and she's more easily to get infections. Do you have any questions for me at this time?
I don't think so, no.
Okay, thanks for coming in today.
Thank you.